A very good afternoon and a very warm welcome to everyone for joining us on this very important webinar. Important, yes, as I think majority adults are aware about autism. Let's proceed further. Yes, now let's begin. Well, today we are here to have an interactive and information webinar that would help you, your family, and your child identify and reverse systems of autistic spectrum disorder. Now let's welcome our honorable speaker of the day, today's webinar. A warm welcome to Dr. Edward Chan. Dr. Edward Chan is a principal consultant psychologist of International Psychology Centre and the clinical director of WellLab. Dr. Edward Chan holds a bachelor degree in psychology, master's in science and learning, second master's in nutritional medicine, and a PhD in psychology. He has numerous accreditation in different modulators of psychotherapy practices, including graduate diploma in expressive therapy with children and adolescents by the Institute of Expressive Therapy of Australia. He is also a certified therapist with the Amen Clinic led by Dr. Daniel Amen, best-selling author of Healing ADD. He is also a licensed Amen Clinic therapist in the use of brain-based therapy to reverse autistic spectrum disorder. He is also an accredited reattached therapist, author of clinical article published in the Journal for Reattached Therapy and Developmental Diversities in 2019. He was also a speaker, invited speaker for the 9th World Congress for Psychotherapy 2020, Dr. Edward Chan. So I would like to pass it on to you, Doctor.
Thank you, Sanjita, for your kind introduction, and we have just seen the cases that you presented to us last week. Very competent and effortful work that you have done. So you are doing the child psychotherapy, child psychological assessment. And to today's topic on ASD, especially on Asperger's syndrome, I think will be very pertinent to your work. But of course, we will be covering adults as well with this disorder, diagnosis and treatment implication. So this is the topic for today. And like you said, we welcome questions throughout the 1 hour webinar. We're going to mute everyone. Tommy will do that. For anyone that wants to ask questions, just raise their hand and we'll unblock your video and unmute you, or you can send us a question via the chat, right? So Sanjita, what would you want to know about Asperger's syndrome in either children or adults?
Okay, let's start with a lot of people, Doctor, since we have a lot of audience watching this live. Right. I think autism in a basic term to people, they know it as it is a classic term. Yes. So when you tell them autistic disorder, it's like a bit, oh, it's a medical term, and they get confused. So, well, I would like to put a brief thing here that it is a complex developmental and a neurological disorder. But often people are confused between the 3 types of autism spectrum disorder, which are autistic disorder, Asperger syndrome, and pervasive development disorder.
That is true. In fact, the prevalence of ASD, autistic spectrum disorder, has increased substantially over the recent years, and that in part would have something to do with the recategorization of the diagnosis. So as you're well aware, as psychologists, and some of us here that might be psychiatrists as well, we use the DSM-5 now, the Diagnostic Statistical Manual for diagnosis. But under the DSM-4, there used to be a Asperger's syndrome diagnosis and autism, right? So recently that has been combined into one, as an autistic spectrum disorder under the DSM-5. And as a result of this, you see a spike of increase of the disorder, not necessarily mean that there are more incidents of cases, but it can just be partly due to the combination of lumping together two previously two previous diagnoses under one single umbrella. So there are different thoughts about the rationale for doing so. But I do think that there's something lost in doing so, and Asperger's syndrome do merit a separate diagnosis. I mean, the main difference between Asperger's and autism would be language, right? Language and IQ, I would say, right? With autism, classical autism, language might not be very present, if at all, that there will be language delay, but you don't see that with Asperger's syndrome necessarily. If anything, you might even see earlier language acquisition, right? And certainly with IQ, with many Asperger's have shown high IQ, although not pervasively, but certainly in a number of subsets of subtests under the IQ tests, right? So there is a researcher, Simon Baron Cohen. Some of you might know him as the developer for the theory of mind test, for example. He contributed a lot to that idea. He has this theory that there is two separate quotients, right? That there is on the one hand the empathy quotient, empathy skills, which there are of course a lot of gender association to it. Women tend to be more empathetic, right? Whereas men less so. But on the other hand, there is a system, what he called a system thinking quotient. That means that these individuals are very capable of thinking in terms of system, right? Of creating a whole system. And you might think of Mark Zuckerberg, Bill Gates. These are people who are excellent in thinking system, very successful, very driven, right? And they tend to be male, right? And they have high, what we call the SQ, system quotient, but very low EQ. So you have these two dimensions, right? Tend to be gender related. But recently they found that actually that there is it is also influenced by hormones. Though those fetus with high level of testosterone, fetal testosterone, tend to be more towards the system thinking, and whereas those that are low would not be, right? So there is this idea that Asperger's syndrome might just be a very masculine, well, not masculine per se, but very male characteristics, right? So you have male, but the extreme male would be very high SQ, system thinking, but maybe low in empathy, emotional quotient. Now, that doesn't mean that we should not do intervention and therapy,
yes,
right? Because there are children especially, and even adults with Asperger's syndrome or autistic spectrum disorder, they do suffer, right, in a number of ways, yeah? And they get isolated, they get bullied, right, because of their poor social skills. And there's another skill, language skill we call pragmatic language skill, right? This is like a social communication skills which we can at IPC measure. We do have a test, a pragmatic language test to measure that. So definitely we should do diagnosis and intervention, early intervention to help children with this diagnosis to learn some of the social skills, pragmatic language skills, so that they can interact more successfully, right? And be successful. We don't want to necessarily negate what they have. We don't want them to lose their beautiful personality, you know. All we want to do is to help them to maybe adapt more successfully into the community, right? So we don't necessarily say that there's anything wrong, right, with the child or the person with Asperger syndrome, right? But there are maybe certain underdeveloped skills that we can help them with to develop, to become more successful in what they do, right? So maybe that answers some of your questions on the difference, right? So certainly, you know, the other the other disorder you mentioned was pervasive learning disability, right? So this might have something to do with the ASD diagnosis, especially more towards the extreme disability part, but certainly not the case with Asperger syndrome. They would have very high IQ in a number of subsets or just normal IQ, right? In a number of areas. So to the untrained eye, it is quite difficult to pick up that there's anything wrong, well, I won't say wrong, but anything special about this type of children. So very often parents would bring their child to us, and you know, they might confuse it with them with ADD and ADHD, and there are overlap of symptoms, right? But also differently formulated for us clinicians who knows about this different type of condition. For example, focusing on a task or in conversation, right? So an ADD child or adult might find that very difficult, right? And then they might not do that. They might not be engaged for a long period of time. And at the same time, that might be also the same, right, for a child or adult with ASD. But for a different reason. It's not because they cannot focus, they cannot attend to the task, but because they find it terribly boring, right? They just don't have the interest to engage in small talk, you know, to talk about the weather or you know, something, talk about politics or, you know, or dating, you know, with girls. So this is just not their interest. And that's why they find it very difficult to engage with their social peer on such activity, not because they don't have the attention to focus on this sort of activity. So you do see some similarity of behavior between ADD, you know, ADHD and ASD, but then the formulation for such behavior are very different. All right, and of course some people, some children, some adults have both ADD and ASD, right? There are some correlation because similar brain parts might be involved as well. But you were saying earlier about a neuro developmental disorder, right? So ADD, ASD is linked definitely to some neurological function, to some neurotransmitters deficiency. You know, neurotransmitters are chemicals in the brain, and there's a neurotransmitter called dopamine, which in WellLab, you know, we can actually measure through urine. And dopamine is responsible for focus, for concentration, for learning, you know, for attention. So for many of these people that suffer from ADD, indeed, the dopamine level is low, is lower than optimum. And there can be many reasons for it. It could be because of they're lacking some of the precursors. In our lab, we do treatment and offering precursors, but our test also depends on which level of test you do. We have very basic neurotransmitter tests, but we have more advanced neurotransmitter tests, which test for the metabolites, the downstream enzymes. Because a lot of these neurotransmitters like dopamine, serotonin, they are broken down by some enzyme like COM, COMT, COM, and MAO. And some of these enzymes, they are all genetically predetermined. So we can be, so the child with ADD can have the COM enzyme upregulated, right? Because all these neurotransmitters will be recycled, will be broken down by this enzyme. So if it's upregulated, if the child's COM is upregulated, that means their dopamine is being broken down very fast. So they end up not having sufficient. So not because they don't have the nutrients, it's just that their enzyme is working faster than normal. So it's just like you imagine your bathtub, you have a very big hole, right? All the water go out before you have a chance to have a bath. Right, so this is what it means, and there are supplements like green tea, theanine. Theanine is an extra green tea that can slow down this enzyme very naturally. They don't even need any medication, as such.
Of course, in our International Psychology Centre,
yes,
WellLab, you have courses that teach on nutrition.
Indeed, yes.
Amino acids and all this that can help a lot of this, and I think this will be very useful to a lot of parents that are unaware of such things there. They are lost and they don't even know their child is suffering from this situation. Even adults, let's say, adults that are undiagnosed, moving around, working and having a lot of conflicts which they can't resolve. And it relates to a lot of clutter, where it is a bunch of depression, anxiety, and a few more that clusters together. Actually, it's the cause of it. Am I right, Doctor? Please,
you're right, and we do have more and more adults coming to our center to seek diagnosis and partners. Recently, a couple of weeks ago, we have a wife that bring the husband in, and say, when my husband diagnosed, to see whether he's Asperger, all right? Because we, our marriage just break down. We haven't had sex for years. I just don't see him as someone I can respect, because he can't do the basic things. He can't understand the basic things. He can't give me any emotional support. And indeed, we diagnosed him with Asperger's syndrome, and we then need to do some couple therapy based on this diagnosis, right? So things that we take for granted, we need to make it very explicit, for him. It doesn't mean he cannot work, but a lot of the signals, he doesn't get. If you like give him some hint, you want sex, he wouldn't get it. You have to like tell him explicitly, that's sex. So love life, sex life, many things need to be expressed in a different way, in a very explicit ways for people with such a diagnosis, but it can be done, right? But we need to focus on one thing at a time. Otherwise, there's too much pressure on the relationship. So many adults come to us to get a diagnosis because they find more and more areas of their life suffer. They just lose jobs, right? And one thing people with Asperger's syndrome is that they are very principled, right? So they're not willing to compromise. That the word is pedantic, right? So in a work environment, sometimes you have to do that. You have to compromise for your boss and all that, and they just ask the boss to fly kite, ask the team to, and they just walk out. So they lose time and time again.
So they can be rebellious and they can be temperamental at times, Doctor?
Well, I wouldn't say it's rebellious per se. They're just sticking to their own principle.
Both, yeah.
right? They
And
are
people
not they are not flexible.
yeah.
Not necessarily
And people
rebellious,
judge
but
them wrongly, and that's
exactly.
the issue.
Yeah. So Tari is asking, is Asperger still a diagnosis? Not in DSM-5,
Yeah.
right? Used to be in DSM-4, we mentioned earlier, right? But we can still use it as as a diagnosis, not in the official manner, right? But for intervention, for the clinical help that can be done, because all the criteria is quite clear, from previous instruments. Yeah, it depends on what is the objective. If you want to get a like a medical diagnosis for insurance or whatnot, no, we can't do that anymore with the DSM-5, right? But if you just want to use it for therapy, and clinical application, yes, we can still do that, right? Yeah.
What about autism as in general, doctor? Is there a range where there is mild to a certain scale, where clinically we have a scaling process?
Yes. So that's why it's called a syndrome. A
Yeah.
syndrome means that there's a full range from a very severe autism where language may not be present at all to very high functioning,
So
right?
the
To very high.
previous, I would say the Asperger syndrome was supposed to be the milder version of autism in that category.
Well, it's
That's how it's labeled.
what we call the high functioning.
Uh,
High
High
functioning
functioning, the
autism.
lower.
They can speak well. They have
Uh,
high IQ or normal IQs, certainly, but there will be deficits in a number of areas, mainly in social skills, in empathy, emotional skills. All right. I think Sonia has a question.
Yeah,
Yes.
I have just one query that is regarding Asperger. So I just wanted to know, is this a case like mostly men's get suffered, get this diagnosed, and there is a certain age for the diagnosis? I mean, do you think that often the male who are not able to communicate, and then most in the couples, it happens like, the emotions are not well expressed. So do you think
Yes.
that, yeah. So
Well, yeah, like I mentioned, that there is a theory that Asperger syndrome is simply a very male, extreme male characteristic, right? So you have a female with a high empathy on one hand here, and then you have male with low empathy, but very high system thinking, right? On the other end, and then autism, Asperger syndrome is where extreme that. So certainly there are much more male with Asperger syndrome. I think it's like 9-1, right? The ratio. On the other hand, it could be partly because female are better in masking the symptoms, right? So that there are differences. There are gender differences in Asperger's between male and female. So with females, with girls, they care more about being accepted, right? That they want to be in the crowd, to be with the girls, and that they will mask, they will pretend, that they will do things even though it's not natural. It's not what they do. They will put on pink dress because they know that is the way to behave. Whereas boys couldn't care less, don't get accepted. They'll just hang around by themselves, do their own things. It doesn't bother them as much. So as a result, that they can get bullied more. They can get certainly be identified more readily than girls who has been are very good in masking their symptoms. But then later in life, they might want to get a diagnosis, right? And the other thing that was mentioned is emotional disorder. So there is certainly a high prevalence of emotional disorder like depression, for example, anxiety, with such diagnosis. And the whole issue of sexuality, that there's also big differences, right? You find, I don't think that there's any peer review publication on this, but certainly there are good anecdotal, qualitative studies, like, losing your virginity, for example, will tend to happen more with females at an earlier age, like 16, 17, female with this diagnosis, that they will lose their virginity because they want to be accepted, and they will know, that they have a predatory boyfriend who said this is normal, we're going to have sex, and they do it, right? To get accepted. Whereas with male, they will know how to approach a girl, right? So as a result, there must still be a virgin. I think you have this film called The 40-Year-Old Virgin by Steve Carell. So it's like a typical Asperger male, right?
Really?
Yeah, there was this film. You can watch it. It's called 40-Year-Old Virgin by Steve Carell.
And do you mean by this like a girl who, like, who's looking for acceptance, and she loses her virginity very early, comes in that Asperger? I mean, we should look into this matter.
Yes, because one of the characteristics is gullibility, right?
Can you just come again, doctor?
Gullibility, naivety, right? They are very gullible. They are easily deceived. They are not very good in reality testing. All right. In one of our instruments we have called the EQI, emotional quotient test. We have a dimension that measure reality testing. So people with Asperger syndrome, autistic spectrum disorder, they score very low in this. They have very weak skills in terms of reality testing. They don't know what is realistic or not. So as a result, they are easily misled, right? So that can be a problem with dating, with relationship. So that can be.
Yeah, one more question, doctor. I just would like to know, if in case the Asperger get into a relationship, do you think that the relationship can make his Asperger going more worse? The reason being, in a relationship, what happens, a girl digs more deeper and she wanted to know more, like why it's not working and what is happening to you. So it could bring more stress in men. And
so I don't quite get your question. So is this a relationship with one partner,
Asperger,
male or female, being Asperger?
Yeah.
Right. Yes, that definitely. If you have one partner being Asperger and the other not, and if they don't seek intervention, there can be a lot of stress, and that's why this couple come to see us, right? The wife is just at a loss what to do. Right, it's like she has 3 children. Not only the 2 small children she has, but the husband is like a child for her. And the husband is also experiencing a lot of stress. He's trying his best, but it's not working. Right, he wants to help, wants to be supportive, but it's not. Right, so that can be a problem. Now, one very interesting fact, that this is a large scale research, is about communication. All right, so it is not that Asperger or ASD people is worse in communication skills. It's about who they communicate with. So in this experiment, you know the Chinese rumor game. You play, you whisper something, and then someone whispers something to someone else, and you have that. Right, so they have 3 groups doing that, right? A group with just Asperger's, right? And a group with non-Asperger diagnosis, and then a mixed group, right? So guess which group did the best?
I would say the Asperger, because of their attention, maybe Asperger's. Is it?
Well, it's because they're very clear in what they say. They don't beat around the bush, So with Asperger, the communication that's flawless, right? So they did very well, no problem. So the non-Asperger also did very well amongst themselves, you know. But the problem is when you mix them together, then this is where the problem starts. So it's not the communication skill per se of who you communicate with, right? So I'm thinking of starting, maybe we should have a dating app, you know, for Asperger's only, and then that there won't be any problem when they go out with each other.
Not a bad idea, though.
Yeah. But you do find that a lot in the community. Asperger tend to like attract Asperger friend and even partner. All right. But sometimes when you have this mixture, then we have a problem. So hopefully that answers some of your questions, Sonia.
Yeah, the last one. I'm just putting one more question here. So about the neurotransmitter test, which you described just right now. So do you think, like, you know, with as if we were discussing about gluten-free diet?
Yes.
For autistic children's.
Yes.
So what do you think we should combine both of them together? Like, you know, it's related to gluten-free diet, or it's something else, like, you know?
Well,
I mean,
I think the fact is children or adults, you know, with autistic spectrum disorder, they are very sensitive, right? They're very sensitive to many things, right? To the environment, to sound, you know, to food, certainly, right? And when you talk about food, plants, right, have a lot of need to defend from being eaten up, unlike animals, right? Animals can run away, but plants can't. So they come up with all sorts of defense mechanisms like lectin, right? Lectin is a chemical. Gluten is very indigestible, right? So the Asperger might be sensitive, susceptible to many of these chemicals like lectin, for example, which are found in nightshades and in many plants. So I would recommend a ketogenic diet and maybe even a carnivorous diet, right? For the people with ASD, just to avoid this whole spectrum of chemical sensitivity. But our lab provide IgG, IgA food sensitivity tests. All right, so these are like a more precise way of testing against a whole bunch of vegetables and even meat, and then see whether you have any upregulated immune response to them, and then you can take them off your food, you know, maybe not indefinitely, but certainly for like 3 to 6 months, and then reintroduce one at a time. So we also have a gut test, a leaky gut test, you know, a stool test, microbiome test. You look at the whole gut health, and that there is research to find that many people suffering from ASD have some gut dysbiosis, leaky gut, you know, imbalanced microbiome. You know, all this can be tested using stool, using urine. I don't know whether City here is there. She told me she's going to join, and she has these prebiotics that is very good in repairing the guts. You know, so there are treatment that can be done. You know,
so doctor, what would you suggest for a kid who is having global development delays? Which test?
Right. I would certainly think that there are some methylation problem. All right. So there's a Dr. Pfeiffer that come up with the Pfeiffer protocol, Pfeiffer comprehensive. So this is a blood test that look at a number of key nutrients. These are cofactors to the brain neurotransmitters like iodine, D3, copper, you know, SAMe. So check out for the Pfeiffer profile. You know, we have an extensive and a basic. So that is one of the key tests. And then you can also look at the gene test for advanced methylation detox. This is looking at the number of genes to see whether they have the ability to detox, do the detox. A number of patients with ASD is the inability to detox properly. So there's an accumulation of toxins, right? As you may or may not know, there's a stage 1, stage 2 detoxification. So that might be inability to do this well. And also, so we have a test on looking at the stage 1 and stage 2 detox as well. as well as the ability to be able to upregulate and methylate properly. That means they can absorb some of these nutrients, like B6, B12, folates, make it to be bioavailable in the brain, or not. So these are a number of key tests we can certainly do. All right.
So, doctor, this is finally going to be the last one. Yeah, so there is some kind of misconception, and there are many of the mothers who are mother of special need. What do? They just do the overdose of omega-3. The reason being they feel that they will help in their,
Yeah, this is a bad misconception, because the truth of the matter is we need both. Our brain is made from fats, all right, and a big part of that is omega-3 and omega-6. This is what we call the LCP, long-chain polyunsaturated fatty acid. So, but the thing with omega-3 and omega-6, that they both have the function, and they're both broken down by the same enzyme, right? So if they're overloaded with omega-3, guess what? The omega-6 cannot get through, then there will be a problem. And also, so there's a precise ratio, like 2 to 1, omega-6 to 1, and our lab have this test. It's called the omega index test, right? Some blood spot, a couple of drop of blood on the finger. You can look at the ratio, right? But in general, so in general, people have too much omega-6, all right? And that is because the food out there, like vegetable oil, for example, which I would not recommend anyone to use. They have like few hundred to 1 omega-6 to 1, right? Like a sunflower oil, peanut oil, all these oil are very bad for you because it blocks out all your omega-3. So it doesn't matter whether you have a lot of omega-3 supplement, it's not going to work. You cannot absorb it, because if your diet is made from all this normal food that you have, even eggs, has too much of omega-6 unless you find some special compound eggs. He has a grandson who was diagnosed with ASD, right, Dr. Wahab, and you couldn't get any help from any of the pediatrician. And now he's doing very well and is totally reversed. All right, so it's a quick intro of Dr. Wahab.
Right. Well, thank you very much, Dr. Edward. This is my life mission now. Since he was cured of autism, this is my life mission. And basically, we have two brains. Most doctors only look at the brain in the head. That's it. We have a second brain, which is in the gut, consisting of 500 million neurons. And they are producing as many as 40 neurotransmitters has been recorded there. And 90% of serotonin, 50% dopamine is being produced there. So we need to fix the gut in order to fix the brain. And this is my approach to treating my grandson.
I would go along with that. I would.
And others. So it's good to know that your lab is able to do all these very important tests to determine the leaky gut, the metabolites, and the microbes. We need to test for all this. So I've been invited on a ASEAN platform for autism, but they are not interested in diagnosis, in treating, in reversing. All they're interested in sending these kids to special school and therapy. You have to treat the biochemistry. And all that begins in the gut. So then to cure you have to take care of the good microbes. Because they are producing the neurotransmitter. They are beginning, the detoxification is beginning in the colon. Right?
Yes, so, I would totally agree with that, Dr. Wahab.
Dr. Edward did mention just now about prebiotic. Obviously, that is the only food for the good microbes. And if you take care of them, they will take care of your brain.
That's
and
true.
a lot of these children, they also have, copper overload, methylation problem, as mentioned by Dr. Edward.
Right.
They may have, zinc deficiency.
Yeah.
These are the things that we need to check. Iodine, thyroid, whatever. These are the things that we need to check.
Right.
Not simply
Yes.
institutionalize them in the special school. I think
Very
that
true. Very true.
big
Yeah.
mistake. Right? So
Thank you for that. Yes.
Dr. Edward knows what I've been doing, so you can follow up with him if you need to
Yes.
know more.
Sure. Thank you for that, Dr. Wahab. Yeah. So you know, this is to reiterate the five profile test. You know that WellLab will offer to check out a lot of these nutrients, iodine, zinc, SAMI, copper, all this. Fantastic. You know, we need to ensure that the gut is healthy. When you have a healthy gut, you don't have if you have a leaky gut, then you might have a leaky brain.
Yes, it's true. It is confirmed. If you have a leaky gut, the same inflammatory process is getting to the brain. And if you don't fix the leaky brain, you cannot fix the leaky gut.
Very good.
And
Thank
a
you
lot
for
of
that.
patients don't want to change their diet. That's the big issue.
Yeah. So we believe very much in a holistic treatment. You know, dietary change, having a gluten-free. Just now, you know, Sonia was saying gluten-free, dairy-free, even a ketogenic diet, or even a more a purer form, the carnivorous diet, and you know that you just get bypass or the chemicals of plants and go straight to the fats, good fat meats, you know, and that are some of the options. I'm not suggesting everyone do that. All right. So back to you, the Sanjita, and Tommy, and are they?
What about for all of us that are heading towards being therapists? What kind of therapy that we should look into majoring to in order to help the classification of different therapies that can help this for children and also for adults?
Well, so certainly for people with this diagnosis, you know, they are very logical. So CBT works very well. All right. And in fact, there are various books rewritten on CBT for Asperger's syndrome and ASD. Right. So cognitive behavioral therapy is very logical, very rational, but also therapy to boost up pragmatic language. Right. So to teach some of these underdeveloped pragmatic language skills, you know, how to interpret the metaphors, you know, how to send social skills, how to join in a group, you know, for children, how to negotiate, how develop your assertiveness skills, how to say no, you know, if you don't want to have sex, if you don't want to go home with a boyfriend, how to say no and still have your self-esteem, right? So all these are very, very valuable therapy that we can work with children, with young people, with adults, so certainly, you know, developing their emotional skills, right? You know, all the way down to the so therapy that are more difficult will be those that are more focused on emotions. Like emotion focused therapy is probably going to be quite difficult for people with this diagnosis, you know, for the ASD, because it's difficult for them to feel the emotion, but at the same time, you know, it can be an opportunity to use such therapy to develop their emotions, you know, and it's just an underdeveloped part of themselves. It doesn't mean that they can't feel it, right? But they can be made aware of it, and that can be developed as well, you know. So this is interesting area.
What about schema therapy, Doctor?
Well, so schema therapy is great, right? It is a development of from CBT, right? And the upgrade, if you like, from CBT is it add in the emotional experiential components, right? Which is precisely what people with Asperger's syndrome, with ASD need, you know, the emotional components, right? So it is a wonderful tool to teach them, for them to experience these emotional aspects, you know, that might be lacking in CBT. So definitely well worth exploring. Yeah, but just bear in mind, you know, you need to work with them from scratch on some of the emotional skills, because it might not be readily available, and unlike people without the diagnosis, right? So you need to like do more what we call the attunement, right? In schema therapy, you do attunement. So you really need to get them to attune, feel the body. Where do you feel the emotions? You know, so you really need to spend more time on the attunement process for them to really connect to the emotions, because they are just like walking around, you know, with the head, nothing down there, right? So in schema therapy, you have this mode called the detached protector. So they are number one classic, you know, people with this mode. You know, they are detached from their emotions, right? They do need it. They find it irritating. But of course, we do need it, especially if you're in a social group, you are having a partner that is, you know, without the diagnosis, then your emotional support, right? Unless you are too Asperger in a relationship, yeah, fine. Then that's you too much emotion, that you live in your separate world, you know, and that's fine. You connect once in a while, you know. That is fine. But if you relate with anyone else, then you need to learn how to give emotional support, you know, and then receive that as well. And you need to work with the Asperger on that. I think that there are a number of questions on the chat as well, and maybe you can read out some of these if it's we haven't answered them before, unless you have other questions as well, Sanjita, you know. Yeah.
Yes. All right.
Hmm.
This is from LV. Which type of diet that gives most benefits to autism?
Right. I think we covered that just now. Yeah, you know, the ketogenic diet, carnivorous diet. You know, you can do a food sensitivity test to find out what sensitivities you have. You know, do a rotation, what we call a rotation, 4-day rotation diet. You know, you don't eat the same food every day, right? So go back to our ancestors. They're hunter-gatherers, right? They are not farmers, you know. So farming civilization is very unnatural. You know, our stomach, our body is not evolved for that. It's only like a couple hundred of years where we eat rice every day, we eat bread every day, we eat potato every day. That is not normal. You know, we were like gatherers, you know, we hunt, you know, and we travel around. We are nomad. That is our ancestry, right? We don't find rice every day, right? We might find this berry, and then the next day we eat berries, right? So this is our natural diet. We need to go back to that. Yeah.
Looking at our chat, Tanishni has asked Asperger still diagnosis. We have been
we have answered that. Yeah, we've answered that.
How to assess autism and hearing impairment in children?
Well, you need to ensure that that there's nothing mechanically wrong. You know, that there's no impairment. So there are various medical devices you can do with that. We have a test in IPC where we put a headphone, we put the tone in left, right, you know, we increase the frequency, and you can check for the tonality, you know, hearing, you know, the attention on either ear. But very often there's nothing wrong with Asperger's and ASD children, or even adult with the hearing. It's just that they have sensory issues. You know, like you can bang the door and they will totally not respond to it, not because they cannot hear it, but you know, they are too focused on doing something. They don't see the importance of responding to that, you know. So it could be on a number of reasons, or they overreact to some sound, right? Very often you find children putting their hand on their ear because they find loud sound too problematic, too stressful, that they wouldn't want to go to noisy places, you know, supermarket for that same reason, right? So not only hearing, but visual, you know, things that see, things that touch, that you know. So just yesterday we had a parent that bring a son, and they say, no, the son is very sensitive to touching anything that is soft, right? They have a certain issues with textures, with a number of things. Yeah. Any other question?
One more from Sonia. Can
Yes.
you name a few combines therapies name which can help one to improve pragmatic skills?
Pragmatic language skills. Yeah, you need to do a lot of role plays, right? Yeah. I mean that there's not a like a specific therapy, but therapy that revolve around pragmatic language, and we use that in IPC. You know, whereby we have a few people, we simulate a group situation, like, you know, we then test out the patient's ability to negotiate, to join in, you know, or refuse. We play various social situation, and you know, we might do some modeling, get someone to do that, and then they can like copy and then play that out. So one thing that is a problem for people with ASD is generalization, right? They find that, you know, they can excel, learn these skills quite well, master in this specific situation, but then you change the situation a little bit and, you know, they're at a loss,
Yeah.
right? That they can't generalize. So you need to do it over many different situations and help them to cross that bridge, right? So that is something we do. Yeah. Any other?
Another one from Sonia. Also, if you can suggest for toddlers and for adults, would they both can have the same therapist? Also, the age of therapist matters addressing toddlers or adults, age or gender.
Well, with toddler, it's more social play, right? You get other, you know, especially same age, you know, toddler, and observe their ability to read cues, to join in, to do a lot of the social play, like turn taking, you know, taking turns, which Asperger are not very good at, you know. So you can observe. So we do have this pragmatic language test, like I mentioned, for children, for teenager, they can do, and then you can observe what are the deficits, because there are many different type of pragmatic language, from reading their visual, nonverbal body language, you know, to requesting, to you know, negotiation. So all these need to be identified to see which are specific pragmatic language skills that don't have. So essentially, it can be similar, right? We can simulate some role play for adults too, once we identify their deficits. Yeah.
Yeah, I would like to acknowledge Tan Shri's question that we have, I think Doctor have already answered. How does omega be related to autism? Is there any evidence based to it, Doctor?
Oh, yes, yeah. Well, omega is more related to dyslexia. There are huge evidence on omega 3 and 6 imbalances, omega 3 deficiency for dyslexia. There are books written for it, like, for example, a book by Dr. Storti for the LCP solution. Yeah, for Asperger is there are some overlap, you know, in similarity of the brain, but it's not as direct as for dyslexia with the study on the on deficiency of omega 3 and the omega index. Yeah, but I'm sure it is very important as well, you know, the role of omega. Yeah. But I would encourage you to look up the omega index test. So for those of you who want to look at the full range of WellLab tests, they can just go to www.malaysialaboratory.com, right? malaysialaboratory.com, and then all the tests are listed there. We have the omega index test there, as well as all the leaky gut, you know, there's a whole gut health section there, microbiome mapping and all that is all listed there.
Okay, Doctor. What about is it possible for Asperger patient or a person to fall in love?
Oh yeah, to fall in love. It is definitely.
whether it is just an infatuation, or do they actually feel attracted and for a person and fall in love, do they, or only for certain autism people?
Well, yeah, that's a good question. I mean, what is love, right?
Yeah.
So with people with this diagnosis, with ASD and Asperger syndrome, gender is not so much an issue. There's certainly been research that show that there are more transgender population with people with ASD, right? And that might be because gender is not an important concept for them, right? For people with this diagnosis, they're more into interests, right? So you are interested in cars, doesn't matter whether you're male or female, we have a connection, right? And we connect and we do stuff together and yeah, right? And we are great together. So it doesn't matter whether you're a boy or girl. So for them, it's more that concept rather than, boy, girl, falling in love relationship. And suddenly there are all these feminine qualities. It's not very, females, Asperger, they don't find that very, sensible to dress in style, to to put your hair in certain condition. They don't see the point of that. Right? It's not very logical, right? So that can be an issue for male and not normal males, right?
So that's where attraction and all this thing comes.
Yeah. So the whole sexuality issue, is a huge topic that we can maybe have a separate webinar on that some other day.
Which school will be better for this kids, special school or normal school?
I always recommend normal school, right? So that you are exposed to the whole diversity of stimulus of people, but then you need to help them. You need to help them, guide them in understanding the complexity, intricacies of interactions. Otherwise, that they might be very lost and find it very stressful. So you need to be there to
the case that I presented
last week. Yeah, very, very true. Okay.
So I just wanted to know the same thing. Like, if there is what happens usually with the mother of special need, there sometimes and often they are confused like where to put their child in special need or in early intervention programs.
Yes.
So sometimes if their kid is not high functioning, what do? They think that might they adopt some habits from other kids. So just they are scared of that, so they try to put in a normal school.
Yeah, I would discourage from going to a special needs school where you just mix with ASD or the other worse still all sort of developmental disorders children. Then you can indeed pick up a lot of bad habits. So I would say give a special support, the special therapy of the school to help them, but if possible, expose them to a normal school. I would say that would be a better approach.
Yeah, doctor, how about early intervention centers where they focusly, they plan them how to brush and do their daily routines and stuff?
It depends on the scale of the autism. If they're at the very extreme end of severity, where they cannot take care of themselves, yes, then you can teach them some of these skills, right? Yeah, but for high functioning, you don't need that, right? For Asperger's and all that, they're very good in taking care of themselves, right? So you don't need all those self-care program. It's more the pragmatic language skills, right? The emotional skills, the social language. This is where you need to help them with. Okay.
So I just one last doctor. I'm not going to let you go like this. One last. So one last is like, I just wanted to know from you, like, I don't want to, tell here their name, but there are centers in Malaysia where they are giving therapies one-to-one, ABA therapies. So don't you think that when you give one-to-one therapies, there are no social interaction for them where they lack?
That might be true. Yes.
Do you think this ABA gonna work for special need kids for longer run?
It depends on the severity, right? For some very severe or autistic kids that might need some of that, but they also need social skills, definitely. So, but they might need the ABA to like benchmark and develop some of their self-care skills, attention skill, learning skills that might be useful. But that will also it is more useful to have a model for teach, for example, which look at the function rather than just parroting the behavior, I would say, which is what ABA does. All right.
So do you think that ABA should be for until certain age, like, because it's more of one-to-one, just teacher and a kid. So don't you think it will just delay their social skills more? I mean, if a kid
I should think you shouldn't, you cannot like do just pure ABA. You certainly, I agree with you. You want to combine it, if you're using ABA with social intervention, with group therapy, definitely. Yeah.
So do you mean that you are against ABA only? Only ABA?
Well, it depends on the diagnosis, right? For some very severe autistic case, that might be the first stage that I need to bring them up to scratch for them to be ready to get into a social community, right? That might be the case. But then they also need nutritional therapy as well, and many other type of therapy. Thank you, Sonia, for all your good questions. No worries. Okay, so Sanjay, back to you, and I think time is sort of running out.
Yes, we are just
I think we need to start to wrap up, right?
Yep.
Yeah.
So I think we had a good session today, interactive session, and I would like to also share this to my fellow colleagues, all the participants. We are all on the way to becoming a practitioner with the IPC, which is our International Psychological Centre. So here we are. This is one of the topics for now, this webinar. In future, we'll be coming up with a lot more in doctor's list, and we will keep in touch. Meanwhile, please like us and share with other colleagues, and we may have other people coming. We would like to invite other people, like even parents and those who are interested, even students that are interested in all this, so they can look into all this, which would be very beneficial for them, and maybe a career that you would like to choose with IPC, International Psychology. So herewith, I would like to sign up. Thank you, Dr. Edward Chan, for your wonderful sharing on our topic. And I would like to also thank everybody and for all your attendance. And thank you very much. Have a great day and adios. Take care.
Thank you, Sanjata, for your wonderful reflections, and thank you all for your participation. See you all again soon.
All right.
Bye-bye.
Bye-bye.